alcohol withdrawal. Anyone who drinks goes through alcohol withdrawal. It's a spectrum. The more you drink, the worse the withdrawal. What makes the withdrawal worse? Well, the more you drink, the longer you drink for, whether you drink round the clock, whether you binge drink. I mean, the worst case scenario is you drink a lot, you drink around the clock, and that probably is the worst. What else complicates it? Well, have you detoxed before? If you've detoxed before, every time you detox, it doesn't get easier, it gets harder. Do you have a history of seizures? Maybe you just have regular seizures, or maybe if you've had alcohol withdrawal seizures, it's much more likely and much more dangerous to come off the alcohol. You are more likely to experience a serious withdrawal and a seizure. Have you experienced delirium tremens? That's tremens. That's where, when you're coming off alcohol, you get confused, agitated, hallucinate, bizarre, seizures, tremors, death possibly. It's extremely dangerous. Coming off alcohol, I mean, it's probably the most dangerous thing I think you could do in terms of detox. That, coming off of Xanax, those two are the most dangerous. What else makes coming off alcohol more dangerous? Well, are you dehydrated? That makes it more dangerous. Do you have a history of Parkinson's, multiple sclerosis, Alzheimer's? That makes it more dangerous. You've done it many times before. You've had a seizure before. You have a seizure disorder. You have a metabolic problem like heart, lung, liver disease. You're a smoker. That dehydrates you and depletes vitamins. What else can I think of that makes it more dangerous? Heart disease, lung disease, of course. Another big one, are you a nutritionally compromised? People who drink have poor diets. Why? They don't eat because if you eat, it slows down alcohol absorption. And also when you drink, you irritate the stomach wall, you cause inflammation of the stomach wall, the intestines, and absorption of vitamins does not take place, especially B1, thiamine, B3, niacin. You can also get magnesium and zinc deficiencies. I've seen phosphorus deficiencies. So when I do labs, when people come in the hospital, when I'm detoxing, that's what I'm looking out for. If they're smokers, smoking depletes vitamin C. So the big ones are B1, B3, so thiamine, niacin. Vitamin D3 is deficient usually because they're never in the sun. They sort of stay in and drink. And magnesium, zinc, and phosphorus. This can be very problematic and it makes you very ill and really complicate the withdrawal. So I talked about some of the increased risk with pre-existing conditions that make alcohol withdrawal worse. Generally being in poor shape, dehydrated, poor diet, of course that makes it worse. Now, let's say you're going to withdraw. What's the timeline we're dealing with here? This is what I do with my patients. I'm doing this video because I had someone come in on Friday. She's a 20-something white woman with, she's drinking about 14 beers a night and then 2 beers at lunch. For me, that's not that bad, but you will have she's been doing it for about 2 years, so you will have a serious withdrawal. If it's not handled right, you could potentially have a seizure, potentially die. And it could get very dramatic in terms of hallucinations, disorganizations, bizarre shaking, elevations in blood pressure. That's another one. Hypertension makes withdrawal worse. Here's the timeline. If you drink around the clock, within, say, an hour or 2 hours of not drinking, you'll start to feel it. If you drink every night, you'll start feeling it probably within 24 hours. That's a general guideline. The severity of the withdrawal is dependent on how much you're drinking and how often. Drinking 750 milliliters a day of vodka, those are high-risk people. I've had people drink up to the handle, that has to handle a day. So these are very complicated withdrawals. Also, another problem, are you doing any other drugs? Marijuana, cocaine, opiates, Xanax could very much complicate the withdrawal. So what do I tell people? I said, listen, if we're going to do this, let's get on B vitamins. B1, B3, folate is another vitamin, vitamin D3, magnesium, phosphorus, zinc. Let's hydrate. So I pump them full of vitamins. Those vitamins I name in high doses because they're not absorbing them and because they have poor diets. But I put them on those vitamins and you got to hydrate. Alcohol dehydrates. The people who are dehydrated are more prone towards more severe withdrawal. So you have to prep them. And I tell everyone, just eat chicken soup. There's nothing magical about chicken soup, except it's kind of a clear liquid. It's easy to digest. It has all the nutrients you need. Your stomach's probably got a gastritis and intestinitis, meaning inflammation of the stomach and intestines. So I pound them full of water. I pound them full of vitamins. I tell them stay in a cool place, have a friend nearby, and I pre-treat things that can happen that tell you the onset of this withdrawal is coming is tremors of the hands. This is the most common. Put a piece of paper here and you'll see a little shaky if you're withdrawing. Withdrawing begins an hour after your last drink. So when the alcohol level starts to go down, you're withdrawing. Stay hydrated, take the vitamins, watch your blood pressure, watch your pulse. So pulse, blood pressure, tremor are indications you're going into withdrawal. You should never experience those. Pre-treat. Don't go into withdrawal. It's extremely dangerous. Once someone's getting into tremors, it's hard to get them out. So within an hour of stopping, I'm already treating with either Klonopin, Ativan, or Librium. Chlorodiazepam epoxide is Librium, Klonopin is clonazepam, Ativan is lorazepam. Those are three we use. Their half-life is long enough, meaning they last long enough to slowly bring the body down. So initially, we give a lot initially. So probably start on a Thursday or Friday. The whole process takes 5 days. The worst day is 72 hours into it. 24 hours, you must pre-treat in the first 24 hours to prevent any tremor, elevations in blood pressure. By the time the blood pressure is high or the heart rate is up, it's a little late. You could still deal with it. I tell people at that point, chew on the Klonopin, the chlorodiazepam epoxide, which is Librium, or the lorazepam, which is Ativan. Telling them to drink, have a detox buddy nearby. Get through the third day. Medicating every 4 hours, checking in on yourself. Make sure you sleep. It's critical that you do sleep. This is pretty much for people using alcohol. If you're co-administering or have a co-addiction of nicotine, tobacco, opiates, benzodiazepines like Xanax, or some other benzodiazepine like Valium, diazepam, it's much more complicated, much more dangerous. This is not to be fooled around with. It is extremely dangerous. So I've been doing this, 30 plus years. My patients have my cell phone. I said, listen, if you develop a tremor, let me know. That's an initial sign that things are going south. What have I seen go wrong? People get psychotic, hallucinating, delusional, completely disorganized. They can't walk, talk, eat. They're curled up in a fetal position, squirming in the bed, doing bizarre things. It is a life-threatening situation. It is not to be taken lightly. It is extremely dangerous. I do it. I pre-treat so there's no drama. Nothing happens. I give people also blood pressure meds like clonidine. It helps with the body's elevation in blood pressure. It helps the body, the feelings of withdrawal be subside or be minimized. So vitamins, clonidine, a benzodiazepine like Klonopin or Ativan, Librium, lots of hydration, vitamins, rest, no stress, no physical stress, no activity. And so they're a little medicated the first 24 to 48 hours. That third day is when I'm saying, okay, this is the hump. We have to get through the third day. Once I get them through the third day, okay, by the fourth and fifth day, and then I may use sleep medicines for a week. After 7 days, you're out of the woods. After about 5 days, it's pretty safe. By the 6th and 7th day, off alcohol, you're pretty safe. Now, that's all fine and good. You're off the alcohol. Do you know what happens now? Cravings for alcohol are incredible. And cravings for sugar, because alcohol is sugar, basically. It is a sugar. But also you get other complications. If anyone had a pre-existing depression, anxiety, or panic disorder, coming off the alcohol makes that dramatically worse. Keep that in mind. And if there's a history of psychosis or mania, the detox itself will put someone into a depression, manic, or psychotic state. So you have to deal with that. For the basis of this video, that's about the warning signs. There's no way for me to go into each individual case. I mean, this is a general video. I thought about it. I said, oh, I don't include this, or I don't include that, because it's impossible. Each patient who comes in is so different. They're on different meds. They're in different physical states. They have different social situations. They have different needs. So I have to factor all that in when I detox people. And I do it a lot, and it's scary. I've never had any problems, and I've taken people off a lot of alcohol. I mean, I've had people drink up to 1 gallon a day. You know, right now I have someone who's relapsed, and he's probably drinking 20 White Claws a day. He's lost the ability to move, to walk. He's pretty much in a chair now. His legs have gotten so weak from the neuropathy caused by the alcohol, he can walk barely. He's unsteady on his feet. That's what alcohol does. Also, heavy alcohol shuts down your pancreas, pancreatic pseudocyst. You need your pancreas to regulate blood sugar. You need your pancreas to digest foods. So it can shut down from drinking. Not to mention stomach bleeds, intestinal bleeds from alcohol, liver disease. With all that said, the biggest problem that alcohol does is it affects your central nervous system. This thing, your brain. Memory problems, thought problems, cognition problems. Chronic alcohol use can lead to memory loss, which can be permanent, Korsakoff disease, or temporary, Wernicke's encephalopathy. There's all sorts of motor problems from heavy drinking, coordination problems. It affects the cerebellum, which sits back here and does coordination and rhythmic movements. And I've seen it all. Not to mention, I've seen it affect the autonomic nervous system, where people urinate on themselves, defecate on themselves, become forgetful. It's pretty serious what it does to the central nervous system. So the one thing everyone's like, oh, is this going to destroy my brain cells? No, it doesn't kill brain cells. You know what it does? It makes them not work right. And the longer you drink, it can make these brain cells not work right permanently. So that's a little cheery news from, Dr. Agresti here. Hey, the bulk of my stuff goes out on the blog, dragresti.com. I appreciate the likes. The algorithms need the likes. I appreciate likes, subscribe. Shout out to my friends in Canada. They're now my most popular watchers besides the US. And the United Arab Emirate is a close third. Also, I appreciate people take a look at my book, Tales from the Couch, on Amazon.com. Thank you.